The Sierra Club Global Population Environment Program is based here in DC, and they are working on connections between population, environment, and health. And I got involved with the program as an undergraduate student, as one of their student fellows. And so I came to DC and spent the weekend here doing a training, learning about the program, learning about how to be an effective advocate, and then I could take those tools back to my university campus and share them with people on my campus, so young people, different students and groups that were on campus. The issues of population, health, and environment are pretty foreign to a lot of people. It was something, I got into the program from a women's health perspective, and so I wasn't necessarily from an environmental background, and that was challenging for me at first to connect the population, health, and environment. And so then it was kind of put on me to figure out how to connect that for other people. A lot of it deals with figuring out where people are in their attachment to the subject, if they come from an environmental background, or if they come from a health background or a development background, and trying to figure out how that program can connect to them, and making those connections for them, helping them, and then it can kind of become a bigger picture and take off from there. So at first, no, I think people don't think they have a connection to the issue or that it really involves them, but I think once you start talking with people, and once I got people in meetings or in presentations, they really start to see how they were really central to a larger issue. So we traveled to Ethiopia on a study tour, and the Sierra Club Global Population Environment Program tries to do about a study tour once a year, in which they take a small group of activists to a country where these issues are really, really central. It's challenging in the United States to see some of the population and environment issues right in front of you, but when you go to particularly a developing country, particularly Ethiopia, you see the effects of climate change right on the ground, and people are dealing with it. And population is a large problem, and people in Ethiopia particularly, one of the reasons we went there was because they've had tremendous success in connecting population, health, and environment within communities and starting integrated programs that work through development or towards development through population, health, and environment. So it's this really integrated model. So the aim of the study tour is to take activists to countries where they're using these programs to really see what they're like on the ground. And for me, it was nice because I had heard these issues theoretically, talked about them in meetings, and shared them with people on my campus, but I kind of lacked that concrete example that I could really share with people. And I think going there and seeing it firsthand was tremendously moving, but being able to share that with other people it's just more meaningful to have these kind of concrete examples and stories of how population, health, and environment are working together, and how development programs are using those integrated approaches towards projects and building communities.